People are just sitting around too often. They want to come home after a long day of sitting in front of a computer and they want to sit on the couch, but then they want their body to get better and they don't want to be in pain, and I'm like, you have to put in the work. You have to put in that movement. My biggest thing is I always try to tell people not to sit and they don't need to move like a robot. We don't need to be perfectly upright all the time. I just say the best posture is movement. So moving more often. If you're in the car, you like to lean on the center console, let's lean on the door every once in a while. You like to drive with your left arm, let's try to switch with your right arm. If we're always at the computer using that mouse on the right side, let's try to switch over here. There's no bad posture. The only bad posture is one you can't get out of. So if you've adapted over time and over years and your body's adapted into that position and you can't get out of that position, then there's a little bit of work we got to do there. I always tell everybody the body's going to adapt, right? It's going to adapt in a good way, or it's going to adapt in a way that's not as functional. The pressures and the tensions that you put into that based off of your movements and your static postures, things like that, will force the body to change and adapt over time. You've got to put more time into more movement.
Thank you for listening to the Generational Health Podcast. Today, I had the opportunity to sit down with Dr. Cory Baker. He is both a physical therapist and chiropractor and fitness extraordinaire. He knows a lot about a lot. So had a really good conversation with him about a lot of different things from fitness in adolescence all through later age. So anyway, it was just kind of out there. We talked about lots of just different things in the space of chiropractics, pediatric chiropractics. If you have babies, how soon you should see a chiropractor to potentially help resolve some concerns that babies could have during the birthing process. So it was a really interesting conversation. I think you'll enjoy it. As always, want to thank our main sponsor for making this possible, Hiva Health. You can find them at www.hivahealth.com. They offer a wide range of therapies and treatments from medical weight loss to hormone replacement and general longevity. So give them a look. Thanks for tuning in. All right, we're live. Dr. Baker, thanks for coming in, man.
Of course.
It's
happy to be here.
Yeah, I came across, I know of you just from being around here, and a lot of people that I know go and see you, and they make certain comments about the way you work. And so I thought, okay, this is someone I need to pick his brain a little bit. So thanks for coming in. I really appreciate you taking the time to fight traffic and get up here on your day off of all days. But maybe we'll just start with like your background, where you're from,
For sure.
growing up, what you were into, why you got into doing what you're doing now.
Yeah.
And then we can talk about your practice and go from there.
I was born and raised out here in Gilbert, went to Higley High School, started at Gilbert High, transferred to Higley.
Okay.
So I'm going to rep Higley. So,
okay.
Played 3 sports in high school, football, wrestling, and baseball all through high school. So just was always busy, always loved athletics, never wanted to be inside. So it was really important to me to kind of, as that future kind of came in, I wanted to be in athletics somehow, but being raised out here, I always knew I wanted to come back here. And so when I moved away to go get my doctorate, it was Southern California. I was like, I got to get back to Arizona. So met my wife before that, and she's from Arizona as well, up in Northern Arizona, Pine Top. So we wanted to be back down here in this area. And that's why we came here and raised our family in Gilbert, because we knew that Gilbert, Queen Creek, right? We knew that's where we wanted to be. And it's just such a family atmosphere, and the city's amazing. So
you seem like a big family guy.
Absolutely. Yeah. My kids and my wife are everything.
Where did you meet your wife?
At the gym.
At the gym.
Yeah. So I got introduced to her, and she was doing sprints on the treadmill, and she shook my hand in a full sprint without breaking stride. Impressed me beyond belief. And I walked away, and the guy that I was with, I turned to him and I said, I'm going to marry that girl one day.
True story?
100%. Yeah. And so then we started, she came in, there's a lot more to it, but we kind of started talking more. She came in, kind of started talking to me a little bit more, and we've been together since. It's been 13 years together and 11 years married as of last weekend.
Nice. Congratulations.
Yeah, so then we got 3 babies, 2 boys and a girl, and they're my everything. Those 4 are the reasons why I push so hard and work so hard and continue to learn and grow and try to just keep adapting and changing with what I'm doing, and I don't stop because of them. So
nice, man. Yeah, man. Well, that's very cool.
Yep.
So what got you into chiropractics? Like, what made you want to do chiropractics?
I had some injuries growing up in high school, right? As with any athlete, we get hurt. I started having a lot of issues. We started going to see a chiro his name's Dr. Andre Solano. He's with All-Star Health. He's out here. He's a great doc. I think he's retired now, but he took care of me since I was 12. So with all the injuries that I had and how much I saw how he helped me just by using his hands and using specific adjustments and not having to go through medications or surgeries like a lot of trainers were telling my parents, hey, he's going to need surgery on this. He's going to have to do this. We need to do these meds. He's like, no. So he kept me good, kept me playing. And he would sometimes show up to the games and I'd taken a few hits in the football game or given a few hits and then I needed a little bit of work. He'd be down there working on me during halftime. So I just knew that I wanted to be in the medical field, but I didn't want to be giving people medications and things like that where people were just, on pain meds and all these different medications just to help them feel better.
Mm-hmm.
So I knew that using my hands to help people get better was something that I wanted to do. And chiropractic gave me that opportunity to do it. So I just pursued that path and it's been my calling. I really feel like that's what I was meant to do.
What do you love
Yeah.
most about what you do? I mean, what do you love most about running your own clinic and seeing patients?
Yeah.
Like, what part of it like gives you, I don't know, the most fulfillment?
The Probably the biggest thing is when somebody comes in and they're saying, I've been to this person, this person, this person, and I've never gotten this much insight. I've never gotten this much information out of an appointment. I've never learned this much about what's going on with me and why this is happening. And then I've been able to help them get through that, and be able to give them that relief and be able to move better and function better and get back to playing with their kids, doing the things that they love to do, not having to worry about being in pain all the time.
Mm-hmm.
That response gives me validation. Hey, I'm on the right track. I'm doing the right thing. This is what I need to be doing. Yeah.
That's cool, man. So
Yeah.
what's your process? Like if a patient comes in, what's kind of your normal protocol when you see a patient for the first time?
Yeah. So our new patient appointments are about an hour long. Sometimes I run over because I like to talk too much. So all my patients know that.
Mm-hmm.
I'm always 5 or 10 minutes a little bit behind because I'm sitting there talking or showing something. But a new patient appointment is about an hour long. So we go through a full exam. We'll do a full medical history, do a neurological exam, do orthopedic testing, do range of motion testing, sometimes muscle testing, depending on the injury, just to kind of figure out what's going on, get a big in-depth, big picture, 30,000-foot view of what's going on. And then we start zooming in on things. And so I try to pick apart little parts of their history, a little bit of parts of what they did as children, as young adults, things like that. Try to see where these movement patterns kind of started to develop.
Mm-hmm.
Because a lot of times, if it's not an acute injury that just happened, even those, but a lot of times it's just our repetitive micro traumas that happen over a long period of time that kind of build up and create these injuries that you just wake up with one day. You don't just wake up with something one day, that's not how the body works in that aspect. So we have to kind of work backwards, peel back the layers and kind of work through everything to figure out what's going on. So I think that's what's appreciated a lot is taking that time to figure out what's going on. And then I break it down for them, give them all the information that I found, do a review of systems with them and just say, hey, this is what's going on. This is where I feel we need to start. And I always say, I try to under promise and over deliver. So that's kind of where we go about doing that.
So if it's not an acute injury, I think there's just, there's tons of people that have desk jobs or, other types of things. They're constantly kind of in the same positions. Are there kind of like three main pieces of advice that you give people around posture and just to try to alleviate some of these longer term problems that they might have?
Yeah. My biggest thing is I always try to tell people not to sit and they don't need to move like a robot. We don't need to be perfectly upright all the time. I just say the best posture is movement. So moving more often. If you're in the car, you like to lean on the center console, let's lean on the door every once in a while. You like to drive with your left arm, let's try to switch with your right arm. Just different patterns. If we're always at the computer using that mouse on the right side, let's try to switch over here. Like little simple things that might not seem so significant, just changing that posture and moving more often and not keeping up these repetitive patterns all the time, that's a big help. So, and I always let them know there's no bad posture. The only bad posture is one you can't get out of. So if you've adapted over time and over years and your body's adapted into that position and you can't get out of that position, then there's a little bit of work we got to do there. And that could be a little bit of troublesome,
Mm-hmm.
but there's no bad posture. And I always just tell them move more often, right? So if you're sitting in the car for long periods of time, driving, sitting at the desk for long periods of time, you've got to put in the work to counteract that. You've got to work out of that. You've got to put more time into more movement, whether you want to do Pilates, workout classes, go on a walk, ride a bike, play with your kids. a lot of times we're just too sedentary. People are just sitting around too often. They want to come home after a long day of sitting in front of a computer and they want to sit on the couch, but then they want their body to get better and they don't want to be in pain. And I'm like, you have to put in the work, you have to put in that movement. So
Yeah, I mean, would you say you see more patients that come in that are in pain because of sedentary lifestyle versus those that it's acute pain from some injury that was maybe they tweaked something at the gym or they got in a car accident or something like that?
yeah,
How much of what you do you see it's just people with just poor life habits and that's what caused the pain in the first place?
I would say a good amount. I wouldn't say that's everything, but a good amount of people I see in that aspect where I have to kind of coach them and encourage them to be a little bit more active. But I do see a lot of people that are, hurting themselves in the gym and have a little bit more acute injuries and things like that.
Mm-hmm.
But yeah, I would say that that's something that I have to kind of give them some coaching on and give them a little bit of a push to be like, hey, you need to be more active. We need to get you up and get you moving a little bit more. So because I'm in sports medicine, I do see a lot of more of those acute injuries. But because I am more of a family practice, I do get the moms and dads that are, just living life and doing things with kids and just busy all the time. And just,
Mm-hmm.
they don't ever feel like they have time to themselves. So I have to kind of encourage them to, hey, I've got 3 kids. We've got 6 businesses. I'm not trying to compete with you, but I want to tell you, you can do this. And I want to give you the encouragement and I want to give you the guidance and kind of give you that little push to do a little bit more for yourself so that you feel good and you can start feeling better, and rather than feeling like you need to live in pain all the time.
Yeah, I feel like I'm an active person and, I try to work out and I try to eat right, but I still have my own like aches and pains. So it's kind of
Mm-hmm.
interesting when you said, if you're driving and you got your one hand on the steering wheel and you're used to this motion, like I never really thought about the importance of trying to balance that out. So
Mm-hmm.
even something like that, I mean, what kind of problems could that create for somebody if they're just used to that same position driving?
Yeah. I always tell everybody the body's going to adapt, right? It's going to adapt in a good way or it's going to adapt in a way that's not as functional, right? And so when you patternize yourself into positions all the time, then we kind of see these changes throughout the skeletal system. Because again, your skeletal system is your framework. I always kind of use a house analogy, right? Your framing of the house is what's going to dictate the size of the rooms, the shapes of the rooms, how the drywall looks, if everything's even and level, right? So the skeletal system is kind of that inner framework, right? And then we have our soft tissue, ligaments, tendons, muscles, things like that. The pressures and the tensions that you put into that based off of your movements and your static postures, things like that, will force the body to change and adapt over time, right? So for years, if you're, sleeping only on your right side at night, your body is going to adapt to that kind of position. And it's not going to be like a major kind of change, but over time that can lead to some increased stressors on one side of a disc in the low back compared to the other side of the disc in the low back, right? Or a shortening of a tissue on one side to the other side because you're laying in that certain posture, because you always sleep with your arm up in a certain position. You're always on your right side with the leg slung up on one side, right? Like that typical posture we all kind of sleep in, right? Again, that's not going to be the sole cause of everything, but that adaptation, you become adapted into that position. So then your body has a hard time knowing how to move in a broader range of motion outside of that, right? And I'm using sleep as a generalized kind of like example, right? There's so many more examples that go into that, but we all know how we all sleep with that leg slung up, or sometimes we're on our stomach with our head turned and that leg up to the side, right? So our body becomes adapted to those positions, and that's just that repeated stress over time, and that's what we call plasticity response. So
Yeah, I actually have a side that I sleep on. And when I switch to the other side, I'm comfortable laying in that position, but I always wake up with like pain on that one side. So I always end up going back to the other side.
yeah. Yeah.
I probably need to come see you for that reason. But I mean, it doesn't hurt during the day. It's only when I sleep on
Yeah.
that one side. It's like, it's almost feels like it's in like my lower back, but it kind of goes into kind of my abdomen a little bit along that bottom part.
Yeah.
Or if I'm laying on my left side, like it just all of a sudden I'll wake up and I'm like, man, it just feels like a dull ache down there.
Yeah.
I'm like, why is that? It's not like I'm not sleeping any different than the other way, but I'm a side sleeper, but it is just kind of that side position.
Yeah.
Just kind of hits me.
Yeah.
I don't know why.
Absolutely. Yeah. And that's another good example right there of how the body adapts over time. Mm-hmm. So whether it's sleeping in that position, driving in a car because you're a long distance driver, sitting in an office job, there's different patterns that our body adapts to all the time. And so our body needs movement. Our spine is individual segments for a reason. It's not one big long stiff rod that's in our back. It
Mm-hmm.
needs movement. It needs that segmentation movement of those individual segments, and
Yeah.
it needs that constant movement. It likes that constant movement.
Yeah.
Right? And that's what we were kind of developed to be doing, not just sitting all the time.
Yeah.
So yeah.
Do you see kids too?
Yes.
You see babies?
Yes.
So what are some of like the common reasons that you'll see a baby?
So the biggest thing is going to be probably one is going to be reflux and colic. Okay. A lot of crying at night and unconsolable crying at night. They just won't sleep. And then torticollis is going to be the other one, kind of where that head posture is kind of positioned and sitting like this, right? Mm-hmm. Those are the main ones that I typically see. But again, constipation, another big one, latching issues, inability to kind of rotate their head and latch on both sides when they're feeding, painful latching for moms, things like that are going to be really big for what we can do to help the body and do that body work to kind of help the baby kind of adapt and grow and change and welcome into this new world, and be able to feel comfortable in their new world and be able to do everything that they're supposed to do and grow as they're supposed to grow and adapt to all the, again, stressors that are in the body and in the universe and the world around us.
So we moved here from Houston, and I've got 5 kids. We've got 4 boys and 1 girl, and our youngest at the time was our 3rd. So we moved here when we had 3 boys, and he was, I can't remember how old he was. My wife's probably she'll correct me on this. I swear he was like maybe 6 months old, maybe a little bit older than that. But he had to have been older than that. But when we moved here, immediately he started getting sinus infections, or ear infections, I guess, as a baby. Mm-hmm. So he'd get earaches and ear infections, and it was like he was closer to a year old. And it felt like we were constantly putting him on antibiotics for ear infections. Mm-hmm. And someone came to us and said, I know this sounds weird, but go to this chiropractor.
Yeah.
And we're like, a chiropractor for an ear infection,
Yeah.
So we took Ollie to a chiropractor that was referred to us at the time, and they adjusted him, and he never had an ear infection again. So he probably had that year. So he had to have been older by now, a little bit older, but like he probably in that first year we moved here, he probably had like, it felt like an ear infection every month to every other month. And I'm like, we can't keep giving him medications, right?
Yeah.
Something's got to happen. We thought maybe his tonsils were going to have to come out or something like that. But they end up doing an adjustment, a couple of rounds of adjustments, and it all completely went away. So what in the world happened? Like, how is that connected? Like, how do you work on kids' sinuses? Like, what adjustments are actually taking place to clear that out and make it so it doesn't keep happening?
Yeah. I love working on kids for that reason, because their bodies are so adaptive. They quickly adapt. And just real quick, adults, we have so many stressors that kind of pile up on us and layer up on us, right? So we take a little bit of time to kind of work through things. Mm-hmm. Kids, their nervous systems are so new and changing every single day, right? So the adjustments that would come to mind based off of what you're talking about would make me think they're working through more of atlas, more this upper cervical region through here. The nervous system, up in this area, controls the immune system of the head and the neck. So nervous system controls our immune system in that aspect. So if there was an issue with communication to the inner ear there, or the eustachian tube, because babies' eustachian tubes are level, right? They're not angled down like ours. So their drainage is going to be a little bit poorer, I guess you could say. Mm-hmm. But then we also have a bone inside of our skull called the spheno-basilar bone that kind of dictates the palate there, and then the sinus kind of development and everything that's inside of the skull there. There's not a adjustment for that, but there is kind of work that we can do on the cranial bones and the sutures and things like that to kind of help alleviate some of that pressure and allow the body to, adapt and heal and everything that it's supposed to be doing if there is any restrictions there. But the upper cervical spine is typically where I see a lot of issues with babies, just based off of head positioning in utero and kind of being tucked in these little awkward positions while they're in the womb and things. So their body, again, adapts and grows into those positions while they're in the womb, and then they come out and they're expected to be perfect, right? It doesn't work that way. Their body sometimes needs a little bit of help. And if there's that decrease in function and that decrease of neurological communication to those organs that control all that, and to the immune system, you're going to have problems that are connected and correlated with those issues there.
So with these babies, does it make sense for them to come see someone like you even before you notice any particular problems? Or is it more, hey, well, I noticed that my baby's colicky or we're having ear infections. Now we need to go see Dr. Baker. Um, I'm just curious your thoughts on kind of the preventative side of some of these things.
As a chiropractor, I'm all about proactive and preventative, right? So when you come and see me in pain, typically it's already you already needed to be here, right? So with babies, my youngest patient was a day old, right? And so I see those babies thrive so much better than babies that come and see me when they're 6 months old, a year old. I see the babies that when they're coming to see me a day, a week old, they're just good. Like their mom and dads are like, they don't ever get sick. They're always sleeping through the night. We're having multiple bowel movements every day. Like they're just thriving. They're sitting up earlier. They're learning to crawl earlier. They're standing earlier. Their bodies just develop and thrive, But the babies that come see me when they're 6 months old and they've had all these other physicians, giving them medications and treatments and breathing treatments, and it takes a little bit more work to get through that, and they eventually get to that point. But why are we going to take 6 months to a year? And again, when you don't know, and that's okay, but no fault to the parents at all. But there's other options rather than just medication. So
Well, I never would have thought to take a baby to a chiropractor, because when
Mhm.
you think of a chiropractor, you think of like, like smashing and beating people up and all that kind of stuff.
Yeah, the typical
which
stuff.
is which is it's crazy because we can talk about this too, but like I've never been to multiple chiropractors that weren't all completely different. The way they ran their practices, their procedures, like kind of the routine when you go in, it's all very even down to like an adjustment. Like some don't even believe in like big adjustments, where others are like that's all they do.
Yeah.
So why do you think there's like, how would you alleviate, I guess, concerns of parents that might be like, well, I'm not going to take my baby to a chiropractor? What are maybe some of the misconceptions there of taking a baby to a chiropractor?
Yeah, the first biggest misconception is they think it is like that, right? And I've heard so many stories where, I don't want to do that because I don't want them to be adjusted like I see on these social media videos, right? And the first thing I say is it's completely safe. And what we use is our pinkies most of the time to adjust the baby, and it's about as much pressure as you would use to touch your eyeball. So we're not, massive thrusts or pushing, or we're not twisting necks, we're not twisting low backs, we're not doing any of that stuff. And again, my philosophy on adjusting is I don't use any rotational adjustments anyway. So especially on adults either. But for kids, it's all very light pressure, sustained holds. Sometimes we do some cranial work, which means we're just kind of like a light touch and kind of work helps to ease the tension of the meningeal tissues or the cranial sutures and the bones in the skull. And a lot of times parents are like, are you even doing anything? And I'm like, yeah, watch. And then they'll see their baby's arms just open up and their hands just relax and their legs drop. And then they typically will fall asleep on the table and they're like, how'd you do that? And I was like, that's what your baby should be like. That's the ease. That's the calmness of the nervous system. They don't need to be with their fists up by their face and their knees tucked up in their chest and crying all the time. If there's those signs of tension where they're arching and throwing their head back while they're screaming and kind of arching in their crib and crying and their fists are always up by their face, that's your baby saying, I'm in pain, I'm uncomfortable. Those are all signs and symptoms of those issues. So the biggest misconception is the adjustment style. It's nothing like an adult. There needs to be more education for parents on that, and us as a chiropractic field needs to do a little bit better with that, trying to reach more parents in that aspect. And I think physicians like OBs and midwives do a great job, but OBs, and I'm not trying to call anybody out, but they could do a little bit better of educating their mamas on, hey, there's other natural options too that you can go see, rather than just giving a baby a medication right out of the womb, right?
Yeah.
So yeah, it's something that I feel like is an uphill battle a lot of times, and that's where I think as a chiropractor I'm willing to fight that uphill battle with the education. But sometimes you get tired. You're like, I hear these stories all the time. I'm like, when are we going to get through this? When are we going to get past this like dogmatic thought of like, I'm just going to take somebody's head and twist it this way and twist it this way and possibly tear an artery in their neck or something like that, which is what the news loves to blast everywhere, right? But That's what we're trying to work on. That's where we're trying to get better at. That's what I'm trying to get better at, is educating my patients so they can educate their friends. And then we can sit here and have these conversations like this to get to this point here. So,
Oh, that's good.
yeah.
You said you don't do any rotational adjustments, which is, I'm assuming, just like if I'm laying on a table
Hmm.
and
Yeah.
my, my knee is bent over and it's one of
Hmm.
those,
Yeah.
lower back kind of, you don't do that. What's the reason for that?
So the lumbar spine does only has about 3 degrees of rotation with way the vertebrae are formed. So to rotate somebody and put them on their side, push their shoulders one way and bring their pelvis the other way, and then just body drop on them, there's no specificity to that. And this kind of gets into my method of chiropractic and the method that I use, which is called the Gonstead method of chiropractic. So Dr. Clarence Gonstead was a chiropractor, um, passed away in 1978, but he kind of created this Gonstead method of chiropractic where we use biomechanically sound adjustments where we don't use rotation, because what he found is that the vertebrae moves backwards first when it becomes injured or subluxated, and then it rotates left or right, and then it shifts up or down. So there's 3 directions that we have to kind of analyze and figure out which way we need to adjust. So if you use a rotational style adjustment, which we call those rotary adjustments, you're only correcting 1/3 of the problem, right? And you're just getting a temporary cavitation, which is the pop that you hear, and which is just a gas exchange in the joint. It's not the bone popping or anything like that, like everybody thinks it is. But you're not really correcting the movement dysfunction, because again, we're not moving bones, we're correcting the movement dysfunction, right? The body has a set range of motion that it can work in, and when it gets injured and stuck in those positions. And so whether that's a chronic long-term thing that we got to work through, or it's a new acute injury, right, we have to correct that movement dysfunction and restore that function in that joint so that that joint can function with the rest of the vertebrae above and below that area. So rotational adjustments are not my thing. I don't like them. I got injured a few times by a few chiropractors that used rotational style adjustments. So, taking the head all the way to the side and thrusting into that, it's not my thing. And I just chose to use this method because it made more sense biomechanically to me. And I see patients see results so much faster because we're correcting all 3 of those directional restrictions, and patients are actually seeing changes rather than come back 2 to 3 times a week for the next 16 weeks, kind of
Mm-hmm.
typical kind of protocol that most, I don't want to sound like I'm dogging on my industry, but that's typically, what you kind of see is, you want to see them 2 to 3 times a week for so long. And then they're like, well, I never can stop because I never feel better unless I come see you. Right. So that's another big misconception that I'm trying to get rid of, is I try to see the patients as least amount of times possible, is what I tell them in their new patient appointment is, hey, I don't want to see you for the rest of your life. I want to see you outside of here. Maybe we can be friends, but I don't want you to have to come in here and rely on me to
Yeah.
feel good for the rest of your life. So I'm going to try to get down to the root cause of this, and I'm going to try to help you as best I can. And, at a certain point, I'm going to say, hey, you've got the tools and the education from everything I gave you through your corrective exercise and your lifestyle changes and things that we talked about. Now it's your time to go kind of work on that. And we'll check in later on, and I kind of push them out a little bit, push them out a little bit further, and push them out a little bit further, and usually they're good.
Hmm.
Yeah,
Yeah, it feels like most chiropractors kind of have a similar regimen. It's
hmm,
a lot of twisting and a lot of that kind of
yeah,
stuff. So obviously what you're doing is working, because a lot of people bring your name up. They swear by you. They couldn't, kind of to your point earlier, I've gotten to so many people and
yeah,
could never figure out the pain. And, Dr. Baker figured it out for me. And so it's almost like, even though your method is from the 70s, it almost, people talk about it like it's this new
right,
unconventional method, but it's really just pretty, like, you're just getting down to like the basics,
yeah,
um, which is kind of cool, and it's working for a lot of people. So
yeah,
um, with adolescents, do you see a lot of teenagers too?
yeah,
Probably a lot of sports injuries
yep.
and stuff like
A lot
that.
of high school athletes. Yeah.
um, I guess I'm curious, like, what kind of lifestyle, and or I think one thing that comes up a lot with kids that are going through puberty, especially athletes, they want to be big and they want to be
Hmm.
strong, and they're worried about their height and all these sorts of things.
Yeah.
What types of advice would you give either a teenager or their parents about, like, just giving them the best chance possible to develop properly? because everyone's built differently. We all have different genetics,
Yeah.
but you know, you don't want to like stunt someone's growth. So like, what are some things that could potentially stunt somebody's growth versus really help them thrive and be kind of their most optimal self through adolescent years, whether it's nutrition, some sort of workout regimen, like how early should they start lifting like weights or resistance training? At what point is, you know, cardio, all that kind of stuff, just generally speaking here. But like, if you had to lay out a plan for your
Yeah.
boys when they're older,
Yeah.
you know, what would you have them do? Like how early and what sorts of things should they be doing to optimize their hormone development during those years, but also avoid injury?
Yeah, for sure. No, it's a great question. So I go back to the nervous system, right? The nervous system controls everything we do. If we don't have it functioning correctly, we're pretty much just hooked up to a ventilator hanging out in the hospital, right? So that's how important it is to make sure that everything is communicating with all of the body, right? And that's your organs, you know, muscles, tissues, joints, things like that, right? So for adolescence, that's when I started seeing my chiro when I was 12. So I woke up with excruciating growing pains all the time, having multiple injuries all the time, and going to see him helped me kind of develop and grow into better overall human, but a just better athlete. And just, I was able to have more body control. I was able to work out and train, and I felt more confident with that. I didn't have those aches and pains that I was typically waking up with as a 12 and 13-year-old, which is not common, by the way. It should not be happening like that. So I first of all say basics is start making sure the skeletal system is developing and growing how it's supposed to, right? My son, for example, right now, he's one of my current case studies. I guess I could call it that way. He's 8 years old and he has about 11 millimeter hip drop. So his left hip sits about 11 millimeters lower than his right side does. So typically with growth spurts, you get a leg that kind of grows a little bit more dominantly during the growth spurt, and then the other one kind of catches up the next time around. But that big of a drop, we see the spine start to kind of change shape, and his vertebral body is actually starting to change shape because of that sustained pressure from that curvature in his lower back that's happening. So things that I can work on and I can correct, but I was noticing it, watching him walk, watching him stand, watching him run. I'm seeing his knees start to change position, his ankles start to fall in and become more pronated, all because of the dysfunction at the pelvis and in the hips. And so he's not able to move properly. So his body's trying to compensate and use other joints and other tissues in a way that they're not typically meant to be used, but they will be if they have to be. But that's going to force him to not be as functional, not be as fast, can't jump as high, can't run as smoothly. You know, I call him my little baby giraffe right now, where he's just kind of all over the place because he's 8 years old at 4'11", and you know he's 90 pounds, and he's just trying to learn how to control his body. But again, the nervous system controls all of that. So if we can optimize the communication pathways to his body, he's going to be able to develop and grow how he's supposed to, how his body's designed to do, right? So my job is to take those stressors off of those joints and those soft tissues and things like that to help them do that. So I would say let's start there first, especially as an athlete, because if you want to be faster, have better coordination, better hand-eye coordination, better body mechanics, make sure you can actually communicate to the extremities and the spinal column and the pelvis and the head and the neck that you're trying to use for your sports. Secondly is going to be your nutrition is huge, right? Nutrition is part of my background with kinesiology from ASU. Is like the nutrition side of it was very important to me. Strength conditioning is my other background. I've been a strength conditioning coach since I graduated from ASU. So I love training athletes. I love working out. I've been working out since I was 17 years old. So nutrition's been a huge part of my life. So without getting into too many specifics, because there's so much, you know, all over the place of, you know, eat this per pound of this and, you know, eat all this. And I'm sure you've had a lot of people that have talked to you about that on this thing. So, you know, I always say start with protein first. Your protein is going to be your main source of nutrients that you should start with. And then you can kind of branch out into where your body needs. If you need a little bit more carbohydrates, a little bit more fats to fill in the extra calorie there, right? But nutrition, kids just, they need good quality nutrition. We're not driving through drive-throughs. We're not, you know, little treats here and there are fine, right? But like, we're not constantly going through drive-throughs every time. You know, if you want your kid to grow up, be big and strong, we can't be feeding them junk. So, and then sleep. I always coach my athletes on sleep. Like if they're up on their phones all night, or they're, you know, up messing around on, you know, their iPads and not falling asleep, and then they're having to get up early to go to practice, and you're only getting 5-6 hours of sleep, you're not going to grow. You only repair and grow while you're sleeping, right? So sleep is huge. But your nervous system, again, controls all that. So I keep coming back to the nervous system, and the function of the nervous system is very, very important. So I get a lot of athletes coming in with a lot of injuries that they don't even know they have going on. And then we start working on them. They're like, man, my sleep's gotten so much better. I'm more hungry. My stomach doesn't hurt after I eat anymore. I'm not constipated after, after a big meal. I'm in the gym and I'm lifting more. My weight is going up. I'm gaining more muscle. I feel stronger. I feel like I can cut better on the field. I feel like I have more speed. I'm like, yeah, bud, that's what we've been working on, dude. That's what you've been trying to achieve, but your body's been fighting itself because it wasn't able to fully communicate to that area. So,
Is there this concept of stunted growth?
yeah.
Like, I don't know if it was just me in high school and it was like I don't know, it could just be a myth.
Hmm.
But I remember having this impression that if you started weight training too young, that it could stunt your growth. Is that true?
Depends on what research article you read
Okay.
and who sponsored that research article, right? Yes and no. Again, we all have our own genetic code, right? So who knows if you start lifting at 13, were you supposed to be 6'5" or were you only supposed to be 5'11"? We don't know, right? We kind of know what your parents, typically average height of your parents, or, some close relatives, right? But stunted growth to me, I, I would say that I would prefer my son, if I was to coach him, I would wait until we start that 13, 14-year-old range. And not because I'm worried about stunting his growth, but more worried about coordination, body control, and things like that. So I'm not going to put an external load on him if he doesn't know how to properly control his hips, knees, ankles, control his spine, right? And like work through all that, right? Why would I put load on his back or in his hands if he has no idea of how to control that, right? So if you progressively work into that and you progressively teach them how to control an external load, then I think it should be fine, as long as we're not, putting 200 pounds on a 13-year-old's back, which I think
Mhm.
is just, I don't know anybody that would do that, but I wouldn't put it past somebody either, right? Um, but that would be my kind of thing is if you're going to start with them, start with body weight workouts, work into maybe some resistant band things, maybe add a little bit of a light kind of dumbbells. So we're not putting it on a bar. I think a bar kind of locks people in a little bit more. You're more closed chained at that point. But dumbbells, resistance bands, kind of start teaching them what that resistance feels like, start teaching them what that muscle contraction feels like. Once they get used to that and you can see, or the coach or the strength conditioning coach is seeing, hey, I think we can move into this next phase. I think we can add a little bit more resistance because they have a little bit better control. They have a little bit more balance with the weight. They have a little bit more stability there. Then yeah, I think it should be okay. But as for stunted growth, I really can't give you a solid
It's
answer on
hard
that
to
one,
tell,
man.
right?
Yeah,
Yeah.
honestly, you don't. It's hard to say. Like we could say, yeah, it stunted my growth, and I should have been 6'5", but I only ended up 6'2". How do you know?
I think those early
So
years, for me, at least with my kids, it feels like the team sports are awesome. Keeps them running, keeps them team oriented. They're young, but they are getting a little bit of natural resistance
yeah,
anyway, right?
yep,
Through sprinting and running sideways and jumping and
hmm,
all that, falling on the ground and getting back up.
yeah.
So it's stuff like that that goes a long ways too.
Just
Just
body
keeping our
control.
kids active,
Yeah,
and
yeah,
there's a huge problem right now of obesity in children.
yes,
That's a massive problem.
yeah,
So just getting your kids out there, movement, getting them to move, playing sports is great. Not all kids are into sports, but finding ways for them to get some sort of an activity of movements, getting more and more important.
yeah,
I mean, there's the rise in childhood obesity is insane.
yeah.
So,
It scares
um,
me for sure. Yeah,
and it's going to cause a ton of problems.
yep.
Probably give you a lot of business, if I'm being honest.
Yeah, but if
But
that's something we can prevent,
not the
though, like
business you
yeah,
want.
yeah,
Yeah,
no, if that's something we can prevent, I
yeah,
would rather people be healthier and not have to
yeah.
go down that road because I always say it's easier to raise, a healthy adult, than to fix a broken adult, right? So I'd rather take a kid and help them grow and to become this functioning, thriving adult than to have to take an adult that's, late 20s that can't get out of bed,
I got to
right?
assume you probably see a lot of back, spine, nerve issues just from
Mhm.
being overweight, right?
Yeah, I mean, I do have a few. I've had a few where I'm like, oh man, how can we help get you through this to kind of get you more active, to kind of take some of this excessive load off of these joints and the spine and everything. And because being a sports medicine, I'm not just the spine, right? ankles, knees, hips, shoulders, elbows, fingers, you know, all that kind of stuff. We see all of it, but it takes a toll on the body completely. Yeah. And I see little kids coming in with heart rates above 100 beats per minute just sitting on my table, and they're 50 to 60 pounds overweight, you know? So that's scary to me. That's definitely something that, you know, I'm sure us growing up, it was, hey, get out of the house, come back when the streetlights come on, right? I don't know many parents that do that anymore. And I know our world's different now, but that's kind of how I grew up. So I'm assuming that you might have been the same way, right? But I was riding bikes all the time, rollerblading. Like my dad was like, hey, you see those streetlights come on, you come back home, right? But until then, don't come back in this house, you know? And I'm like, okay, cool, I'll go out and play. You know, like that's
Yeah.
how I grew up. So, and I don't see that very often anymore, you know? And that's troublesome, because we have, what I see a lot of is when kids are waiting on their parents, I see them on their phones, you know, just looking down, just sitting on their phones, you know, like they want the iPad, they want the phone. I can only imagine, you know, what's going on, like how many hours they're sitting in front of a gaming console playing video games all the time, which again, it's not terribly bad if it's every once in a while, but it's just like an adult sitting in front of a computer all day at work. You know, you're just so sedentary, sitting in a posture that it's not conducive to heart rate, breathing, digestive function. You're creating that compression through the abdominal cavity there, just sitting in front of that computer. The kids go through the same things. So, yeah.
6 hours a day is the average for an adolescent, which is crazy.
Yeah.
Especially because they're in school all day long and they can't even like do that. But it's like, it's 6 or more hours a day is the average. It blows my mind.
Yeah.
I used to crush it on rollerblades. I'm glad you said rollerblades, because I didn't know if I was the only one, but
yeah, man. I used to make my dad time me. I used to go around the block, and I'd be like, Dad, time me. I'd go around the block, and I'd like come back, and he's like, I was like, how long was that? And he'd be like, he'd make up some time. He wasn't keeping track, but he would always say, I beat my last time, you know, but that was me, you know, but again, I got injured doing that kind of stuff too. And that's okay. You know, you're supposed to get beat up. Your body's supposed to get strong and adapt and things like that. And acute injuries aren't bad. That's also what I see when kids are coming in. It's like, oh, they fell and sprained their wrist. I'm like, that's okay. Like, it'll be okay. You know, like you know, we take these kids that are so sedentary, and then they want to go be active, and then they get this little tiny injury, and then they're like, oh, I'm done. I don't want to do that anymore. Yeah. I'm like, no, it's going to be okay. Your body's going to heal. You know, your body will heal, and I'll kind of give you some guidance here, but you're going to be okay. You know,
I think we do have a lot of parents that overprotect their kids, scared of danger, you know, trying to, obviously you want to protect your kids. Absolutely. You don't want your kids to get hurt a lot, but you kind of want them to get hurt a little. Yeah. I mean, that's how they learn. That's how in the world do you learn how to walk unless you're going to fall? Like, you have to fall a few times. You're not going to just jump on a bike and start riding. Most likely you're probably going to fall a couple times, because that's how you learn. So
absolutely.
You know, allowing our kids to experience a little bit of risk, I think is actually really important for their development.
It's very healthy.
So I'm glad you said that. Actually, I do miss those days of just not having the phones and just being like, hey, if you want to hang out with a friend, you literally had to go to their house, knock on the door, say, oh, hey, can Nick hang out? Yeah. Let me see, you know, you didn't even know if they were home, but you had to ride your bike to their house, ask them, you know. So the days of like the kind of old, it's not even like that old. We're like it's talking like that old. I mean, 15, 20, 30 years ago max. We're, you know, it's like the olden days where you actually would go out to hang out with friends, and now they're just talking to each other on their devices.
You knew where everybody was at by the pile of bikes in the front yard. You know? Like that's
basketball game down on the corner.
Exactly. Yeah. That was, you always had to yell car all the time, because you had to get out of the road so the car could drive by, you know, like that's the fun stuff right there. That's what I want my kids doing, and that's what I have them doing, you know.
That's cool.
Yeah, exactly. We don't let them sit in front of the TV or play video games that much. You know? It's always like, get outside, go play.
Yeah. So it's going to be more and more important, especially with AI and other things coming up. Honestly, devices are going to be a big problem. They are a huge problem right now. I mean, not just the content that they can access, but just their little brains and their brain development. And there is some good that can come from it, no doubt. And access to information is amazing. Yeah. But I'm really worried about devices continuing to just advance and make us more addicted to them. They're designed for us to not want to put them down.
Yeah, so the dopamine hits in your brain that you get from all that. Yeah, absolutely. Yeah, that's your body's craving that, you know, and that's why you keep going back to it. That's why when you're like just sitting around like, I don't know what to do, I'm going to pull out my phone and scroll. It's that dopamine hit that you get in the brain, you know? So, yeah.
So maybe a little bit about exercise science. I enjoy working out. A lot of people that around here, we've had some really great fitness people in here as well, giving us their take on some stuff. But from like an injury prevention standpoint, are there any big compound lifts that you're just like, they're not necessary? Like maybe Olympic lifts that you don't necessarily think they're necessary, meaning the benefits don't outweigh the risk as far as getting injured.
Yeah. Yeah. I think, I feel like it depends on your goals. It depends on where you start, right? I'm not going to take somebody that's a desk jockey and go start with them on Olympic lifting, right? So again, there's an adaptation process that happens through that. And so when I coach athletes, I got to figure out where they're at and what they're capable of and what they're able to handle and what their history looks like before I put them under any kind of external load, right? So if they don't know how to control, tibial rotation or hip movement or things like that, how am I going to put any kind of external load on them and expect them to do a lunge or a squat or a cleaning, like a snatch or, like a clean, anything like that, that demands the body being able to control that and move that while still moving a big external load over top of their head, out in front of them, anything like that, right? So I think that's all kind of like relative to where the person's at when they start, right? So I don't think it's impossible, but I think people try to rush the process too much. I see people going to the gym for the first time and they want to, grab the big dumbbells, or they want to go and get under the bench and, try to get the new PR. And I'm like, but you haven't done that. Like, how do you know your shoulder functions that well? How do you know your elbow rotates that? How do you know if your wrist moves that well, right? You're going to find out real quick, when that weight goes down and that joint gives out or that tissue gives out and that nervous system goes, I can't handle that load, right? I can't handle that. I don't have the endurance in that tissue to do that. Your body will tell you real quick, So I don't think there's a lift that I would say to stay away from. I think you just have to know where you're at and what you've done and what your history is. And you have to have get a professional that can help you with that, right? That was what I would say, right? But compound lifts, I think, are great overall, especially for athletic development, for anybody that's wanting to progress themselves, learning body control, being able to prime that nervous system, being able to kind of use those tissues and those joints how they're supposed to be, but progressively working into it, right? So I wouldn't say that there's one that I would say to stay away from, because
I didn't know if there was like a big one where you're just like, I see so many injuries from this that if you're not like really dialed in, just don't do it. Like, it's not worth it.
Yeah. I mean, gonna be like a closed chain kind of exercise, like a squat or a deadlift or anything like that, right? There's so much that goes into those two exercises right there that when I coach athletes, I start at their big toe, and literally their big toe contact on the ground depicts on how I know how their ankle and their knee and their hip is going to function. So I start at the big toe and then we literally work up from there, right? So that's how intricate that is in that aspect. And everybody's like, I'm just going to go squat. So, but yeah, if you're not dialed in, I probably would, any kind of big external load like that, like a compound lift in that nature, would be something I would say, hey, be cautious with. Get some professional help, get somebody to kind of help you with that and kind of work through that and kind of progress into that. Don't just walk into the gym and start squatting and, put weight on your back if you've never done that before, or if there's an injury that's inhibiting you, that's a whole nother topic we could probably talk about, because there's a lot of doctors will say, oh, stop your squats, no more deadlifting. I'm the exact opposite as that physician. It's like, if you were deadlifting, let's go see where you started from. Let's go see what your body's capable of doing. And then let's try to progress upon that, right? So, but everybody's like, oh, I've got disc herniations in my back, I can't squat or deadlift anymore. That's completely false. I don't believe that one bit. And I've seen multiple athletes come back from those kind of injuries, because the body does heal itself. Those disc injuries are not life sentences. They will heal themselves with proper conservative care. So, but again, that's a whole nother rabbit hole and tangent we could go down.
I see so many people that are, maybe it's just ego, and I'm sure I've been part of it too, where you just lift too much weight. Like, all of these lifts are pretty good and standard. It's not overcomplicated, but a lot of people just put way too much on, they're just lifting too much weight and they sacrifice form for weight, and then you get injured. I mean, I've done it to myself so many times that I've kind of just gotten smarter. I mean, I'm older now, so hopefully I've learned from it, but you get a little bit of an ego thing and you're just like, I want to throw this up, and you're just probably like, probably should have warmed that up a bit more before I did that, because you just end up injuring yourself. But yeah, I don't know. Is there I don't know, if you had to break out exercise by, certain phases of your life, let's say, like, what types of exercises should the high school athlete be doing mostly into maybe your 20s and 30s, and then maybe like 40s and up. I don't even
Yeah.
want to say 40s. Let's say, because I'm in my 40s. So maybe like the teenager through their 20s. Like, what
Yeah.
kind of exercises and how does this evolve? I guess I'm curious about like the
The
kind
evolution
of
of
the
it.
evolution of exercise as
Yeah.
you get a little bit older.
Yeah.
So maybe if we looked at like 4 phases into like your late years, right?
Yeah.
What types of exercises would you be doing, and how would you generally, I know I'm speaking generalizations here,
Absolutely.
be helping someone to really give themselves the best chance at living a full, low pain, happy, strong, long life?
Yeah. Those teenage years to the early 20s, I would say, depending on the sport, depending on their goals, depending on where they want to go, right? A lot of that's learning how to control your body at that point, right? You're just fresh, right? Like you haven't been here very long, right? So learning how to use your body and learning how to control that body is something I would start with. So a lot of plyos, a lot of body weight stuff, kind of a lot of dynamic movements in that aspect, and not adding again that external load on there just too quickly, but as we get a little bit into high school, we need a little bit more size, need a little bit more speed, a little bit more strength, depending on the sport that you're in, right? Like, if we're a football player compared to a tennis player, completely different programming, right? Tennis players, I'm not going to have them benching tons of weight, right? I'm not going to have them squatting tons of weight, right? They need that explosiveness, they need that quick twitch fiber, they need that endurance out on the tennis court, right? Football player, yes, we need quick twitch, power, speed, strength, size, all that kind of stuff, right? So there's different programming for that as well. So um, again, that's where it's all unique to that athlete. So like, this question is like,
Difficult.
it's a
I'm
difficult
trying.
to
I'm trying to
answer.
create some
Yeah,
some generalizations.
yeah, yeah. So and again, my patients will know I'm not a generalized kind of doctor. Like, I'm not. We already talked about that. I don't
Yeah.
generalize anything. If I generalize anybody's care, that could just be like everybody else that's
Yeah.
out there, right?
It's a good point.
So again, to an athlete, to a football athlete, to the evolution of that, to a volleyball athlete, to the evolution of that, it's sport specific, it's goal specific, it's body specific. I've got a 5'11" athlete, I got a 6'5" athlete, I've got somebody that's never touched weights before, I've got somebody that's been lifting since they were 12, right? It just depends on where they started, where they're at, and what they're capable of. And so I know I'm not giving you a direct answer on this right here, but I would start with more body mechanics, plyos, body awareness, how to control that first, and then we would kind of evolution into that lifting. If we want to add some more size, we can put on some more weight on the bar or the dumbbells and things like that, and start doing a little bit more of your compounding lifts and that aspect. um, you have your isolation exercises like your leg extensions, leg curls, bicep curls, tricep stuff, things like that. Those are all great accessory work. I always start with compound lifts first after a proper neuro warm up, neuro priming, right? Don't just jump under the bar right away. But and then as we get past that, we're out of college, we don't go past high school sports or college sports, and we kind of evolution, which is kind of where I was at for a while. I got out of college and I'm like, okay, now what do I do with myself? And I went into bodybuilding, right? Did that for a while, and I started doing the little bit of ego lifting, and I started trying to get the size put on, and I tried to do the typical arm day, chest day, leg day, which I knew wasn't the best for me, but I was trying to kind of fit that mold again, right? But as we age into those mid, late 20s, 30s, I would say it's really important to keep strength training and keep lifting and trying to keep as much muscle as you want to have, all safely, and trying to protect the the lifestyle that you want to live, because at that point we're kind of in a parenthood career, most people parenthood career, things like that. We don't need to be getting hurt and missing work and not being able to play with our kids and do all those kind of things. So again, still training in a dynamic manner where we can still be a little bit athletic with some plyometrics, a little bit of body weight, but then adding in a little bit of strength training and kind of pushing ourselves, maybe go to the gym together and kind of work and push each other a little bit more. You kind of have that little bit of competitive edge still as an athlete. Getting into your 40s, I would say don't stop strength training, but maybe we're not hitting those sets of 2, 3, 4, 5 reps with 90% of your max, right, or 80% of your max, right? We kind of start kind of gradually adding a little bit more repetitions, maybe a little bit more volume. We're still trying to keep load on tendons and bones and joints so that they can stay healthy, because those things like load. They like to be, lifting things and keeping that density, because when you don't do that, you start to decondition faster. And as we age, that's going to happen a little bit quicker, right? So 40s into 50s, and then we get into the later in life, that's where we still want to keep that balance. We want to keep that bone density. We want to keep that muscle strength. So again, you kind of go back to those early years of lifting where your body awareness, body control, balance, muscle activation. That's where I would kind of put those later years, is you almost kind of evolution back into that style of training to kind of keep what you originally had. That's how I would kind of generalize progression of that kind of age ranges there.
What would you say is the importance of muscle later in your life?
I think it's the difference of a longer life or somebody that doesn't stay here as long. I truly think the weaker we get, the less muscle mass we have. Obviously, there could potentially be a little bit more adipose tissue that develops and kind of adds on there, and less muscle, less strength means a little bit more compromise to the joints, to the cartilage, to the tendons. And then we get those degenerative changes that happen in the joints, which then, as we know, that can lead to pain and discomfort and decreased range of motion, which means we move less and less because we're in movement. We are discomforted and we don't move as well. So the less active we are, the less life we live, which means possibly a lot less quality of life, a lot shorter life,
Yeah, it's kind of like, working out and gaining muscle, it's an investment. It takes time.
Absolutely.
You gotta, like, you've been working out a long time. I've tried to exercise for a long time, but really I love the concept of what I'm doing now I'm going to need it in my 60s.
Yeah.
So I'm putting in the work now to help me in my 60s. And then maybe the next decade of my life, the work I put in is going to help me into my 70s, because it'll be there when I need it. Because I think there's just so many people that get into their 80s and older and they fall or they have an accident and their muscle's not there, their balance is not there, whatever, to catch them. They fall, they end up having a surgery and they can't recover. And then they're kind of like downhill from there. That's very common. I see that all the time.
Yeah.
And there's a lot of people that end up passing away just from falling, you know? And so, yeah, I'm with you on that. I just feel like muscle is so important. And all the work that we put in now is really going to be there for us later.
Absolutely.
So it really should be seen as an investment, not as a chore every single day that you have to do. It's like putting money away in your bank account, just store it for later, So
absolutely. Something you don't have to do it. You get to do it, is what I always tell everybody. It's like, you don't have to go to the gym today. You get to go to the gym because you're able to, because you've been putting in the work and you're healthy enough to do that. Right.
Yeah.
And I always say the heaviest weight you're going to lift is that front door. Right. So opening that front door to either get out of your house or get into a gym or get into the garage, wherever you work out, that the heaviest thing you're going to lift is that door, because once you can get past that, then you get into the workout. And I always say, start with 10 minutes. Start with 10 minute workout, a little body weight workout, a little bit of movement, get the heart rate up, and then see what the next 10 minutes looks like. If you want to go another 10 minutes, go another 10 minutes, but I always get that feedback where it's like, well, I don't want to work out today. I'm tired. I worked all day. I'm like, okay, but your body's conditioned and adapted to that. Like, that's all you did. And that's all your body's conditioned and adapted to. Right. So if you want to be more than that and have more than that, and you want to look the way you want to look and have the physique you want to look and have the muscle density and have, the health from that, you've got to do more than just going to work. You got to do, and even when you have a physical job, you've got a manual labor job, your body adapts to that. It's used to that. Right. So where you're at that point, that's all it's ever going to be. So let's raise that capacity. Let's give you a little bit more capacity of what you're able to do. Then that day job might not seem so taxing on your body. You'll come home and you'll have a little bit more energy because you've raised the capacity of your body in that aspect. And now you have a little bit more room to push yourself a little bit more, right? But if you're always there, you're never going to go past that,
Well, and that feeling of, you mentioned the heaviest thing you're going to lift is that front door, is just getting your butt out and into the gym or walking or whatever it is. Things that almost everybody can relate to that. It's not like if someone says, oh, I just don't have the motivation to get out there and do it. It's like, none of us feel like it all the time. Sometimes it's easy because you're just like, I feel like going to the gym. Because you're in that mood and you want to work out and you've been doing it. You built kind of a routine and you feel better. So it is easier when you go a lot. But even guys like David Goggins sit there and swear at their shoes every day. He'll sit there and cuss his shoes out because he doesn't want to do it. But then he starts calling himself names. And then he finally puts his shoes on and he gets out there and he goes and runs like 2 marathons or whatever.
Yeah.
So everyone goes through it. It's hard to do. It's not necessarily easy
Yeah.
to get up and do the work, but neither is it's like putting things aside now for something later. That's always a
Totally.
hard concept to do. Investing is a hard concept to do, but it's so important. And it is really
Absolutely.
kind of the longevity, key is building and maintaining muscle, and even doing it later in life. Like there's a lot of people that think that, oh, I'm too old to build muscle. I should just be walking on the treadmill or whatever.
Yeah.
Nothing wrong with walking on a treadmill, but I mean, research shows you can build muscle deep into like your 80s.
Mm-hmm.
The average life expectancy of a man in the US is in the 70s,
Yeah.
and you can still literally build muscle in your 80s.
Yep.
That's pretty cool.
Yeah.
So it's like, it's never too late to start.
Nope.
Just get out there and grind,
Yeah.
It'll help you live a little bit longer, maybe a little bit better. Not even longer.
Yeah.
It's not even about living longer. I think it's just a little bit about
Quality of it.
the quality of the years we have left. So
Absolutely. Yeah.
but
Absolutely.
Anyway, man, thanks for coming in.
Yeah.
I mean, we could talk with your background in exercise science and physical therapy and sports and nutrition and chiropractics.
Yeah.
We could hit on probably a million topics. I
Yeah.
had no agenda for this one. I thought we'll see how it goes, but I think we could probably
Yeah.
dial in, get a bit more niche, and talk about some other things if you want to come back.
Absolutely.
But one question I like to ask guests when they come in is about generational health. So we try to put an emphasis on this. I know you're a family man, and there's a lot of societal issues going on right now, and what we do, our kids are watching us, our neighbors are watching us, our friends are watching us, and the things we do have a generational impact.
Absolutely.
So I just want to ask, what does the concept of building generational health mean to you?
I love that question. I'm excited about this question. So my grandfather and father didn't really have that kind of, again, sorry, Dad, didn't really have that aspect of health and kind of progressing and wanting to do more for their health in that aspect, right? It was never that way when I was growing up, so seeing that and seeing the health problems that happened as I was growing up and losing my grandfather early in his life, in his early 60s, because of health conditions and issues like that, I said, I don't want to do that. I don't want to be that way. And I always knew I wanted a big family. And so knowing my kids are watching and knowing I'm leading by example, I always make sure that my kids are either working out with me. Sometimes we built out a full gym in the garage, so the kids will work out with me. Me and my wife, we work out, obviously met at a gym, right? So we have that kind of aspect. But we talk about nutrition with the kids. We talk about having protein at every meal. We talk about making sure that we're eating, our healthy fruits and veggies. And we tell them what is a carbohydrate, what is a processed sugar, what's not. We tell them, we break that all down. And whether my 6-year-old grasps that or it just goes right overhead, she's like, this looks good. That's okay, because she's seeing us kind of going through that and cooking home cooked meals together, and we're not going out to eat every single night and things like that. So that was my thing, is seeing the way my family kind of had some health issues. I knew I needed to turn that around so that my kids could lead healthier lives, and then hopefully their kids, and then so on. Right. So that's one of the main reasons. Again, I wanted a big family, and I'm a big family guy, like you said. So the things that I do is mainly for them, so I can stick around and be around for a long period of time, and, have them take care of me when I'm in my 90s. And I told my wife, I was like, I'm going to live into my hundreds. And she goes, I don't want to live that long. And I was like, I'm going to. And so I was like, I'm going to be that 80-year-old guy still working out at the gym. And, everybody's going to know me, and I'll wave to everybody and just kind of be that friendly old guy that it comes into the gym. That's my goal, with chiropractic, with nutrition, with the education that I've been able to achieve over, the last 12 years. I know that I have to lead by example, and I have to be a good example for my kids, and then hopefully their kids in the future and things like that. So
very cool, man.
That question.
Yeah. Thanks for answering that. That was awesome.
Yeah.
Well, very cool.
Yeah.
There's so many people that speak highly of you. If anyone here locally, wants to get, I know you're mostly local, but if someone wanted to get in touch with you, I know you also put a lot of content out there too. So if people want to follow along on like your Instagram, whatever, what's the best way for people to find you?
Yeah. So our company is called Essentials Wellness. We have our website is essentialswellnessco.com. That's the easiest way to kind of get into the office and kind of get into that. My Instagram, Dr. Cory Baker, DC. We have Essentials Wellness Instagram, but that would be the easiest way to get a hold of us, is through that. I'm always on social media. I love talking with people. People ask me questions a lot. I love answering things like that. I'm always there when everybody wants to reach out and chit chat and talk and things like that. So
Cool.
yeah,
Very good, man. Well, thanks
yeah,
again for coming in.
appreciate it. Thank you.
Awesome.
Yeah.
Thanks.